The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
The information contained in this video represents the views and opinions of the persons expressing them and does not necessarily represent the views or opinions of a Ph.D. teaches you, the channel's creator, its subscribers, or sponsors. The opinions do not constitute an endorsement nor the views noted by any government or private agency.
Okay, treatment interventions, goals of treatment. The primary goals of treatment are reducing anxiety, improving functional skills, emotion regulation, and teach the parents. And although that's the last thing there, it's probably one of the most important parts of helping these kids. They have to go hand in hand. When I work with a parent, especially with the parent on our child on spectrum, I just tell the parents once a month, I am going to meet with you. It can be online, but I will meet with you every month. I need to know what's happening at home, what I give them homework. I need to know that you're learning what you need to learn in order to help your child at home. What is the function of behavior? And I think that's really important. So we need to look at what the behavior is and decide what the function of that behavior is. Most of the time, it's one of these things. They're either trying to communicate, it's trying to show that they have a need that they haven't learned how to take care of, like being still or waiting, or there's some type of a self-stimulation situation. Escape or avoidance is a lot of times it's escape or avoidance, and then attention seeking. These are usually why behaviors happen. So when you see a behavior, don't automatically assume they're being bad. And that's what everybody does. Everybody, your teachers do it, your parents do it, your counselors do it.
What?
Okay, everybody.
So the attention seeking, would that also be part of the needing a need to be?
Yeah, it can be, yeah.
Okay.
Reducing anxiety. We do a lot of things we can do first then. So if I'm anxious and I know that I don't want to do this, or if we're going to give them this opportunity by preparing them. My client who plays Uno, I know you want to play Uno and we will play Uno, but first we're going to do some education, some coping skills, some fill in the blank, whatever we're working on. And for 10 minutes, I set my visual timer. He knows in 10 minutes we're stopping. No matter where we're at in the education piece, we stop. We don't finish it. We just stop. And then we play Uno. I'm trying to increase that time. Right now we're at 10 minutes. Hopefully we'll be at 15 next time. And we do talk during Uno, but primarily I'm trying to get him those skills, the social skills, the coping skills. He doesn't want to talk about when he's having a meltdown because I'm going to tell you this, they don't know why they had a meltdown with mom last week. They don't know. Because when you're in fight or flight, you don't remember anything. So if you ask, what happened? Did anything good happen this week? Did anything bad happen this week? Or however you ask, they probably will not be able to remember anything that happened. Oh yeah, everything was good. And in their brain, everything was good. When you talk to mom and mom says, oh my God, it was a week. So it's important to talk to mom. How was the week been? Is there anything specific we need to work on this week? Because that way we can go in and say, hey, let's play with the dolls today. And let's talk about what happened. Mom said, da, da, da. And let's see how we could have done differently play with the dolls for 10 minutes or 15 or however many minutes they can sit and do that, and then go to do something that they enjoy. So the if then is really, really good to help. It also gives them a reward for participating, which is important. I have a client who's not on the spectrum, but mom tends to answer no every single time this client says something. And so when every single time the client says something and the mom says no, and then the next day comes back and says, oh, okay, this is hard. This is hard for these kids. So, helping them understand how can I get through that, or in some cases, hopefully teaching mom not to say no, just say I have to think about it. It is absolutely a power struggle, and we can't afford those here. Help parents do a visual schedule. That's a really good one. We use visual schedules for everything. And, as they get older and they can read, you can do a checklist schedule, but it needs to be something they can see.